Each year, December 1st is commemorated as World AIDS Day, an international day dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection, to recognize those who continue to work to end AIDS, and to pause to remember those who have left us because of this disease. The theme for World AIDS Day 2020 is Global Solidarity, Shared Responsibility. The Pan-Caribbean Partnership Against HIV and AIDS, PANCAP, endorses this theme as it effectively captures the phenomenal effort of our public health champions in responding to the COVID-19 pandemic while working to maintain the gains made in the HIV response. Healthcare providers working in HIV have also been called to the battlefield to respond to COVID-19, a clear demonstration of the type of solidarity in health that is needed for us to live in a safe and healthy Caribbean. The coronavirus pandemic has disrupted health services. An effective HIV response requires continuous service delivery in areas such as prevention, treatment, and laboratory services. Moreover, HIV care and treatment services are dependent on community action to reach those at risk and to support those currently living with HIV to ensure that they are reached and retained in care. National AIDS programs and civil society organizations across the region continue to be challenged, especially in the area of HIV testing, as lockdowns and other COVID-19 measures have prevented persons from accessing services. However, as the region has proven in the past, rising to any challenge with collaboration and innovation is a hallmark of our Caribbean people. Public health practitioners across the region have utilized strategic collaboration to respond to COVID-19 and protect the gains made in the HIV response. In Belize, Enrique Romero, Executive Director of the National AIDS Commission, used his alliance with social workers, adherence counselors from the Ministry of Health Belize, peer navigators, the National AIDS Commission, district committees, and civil society organizations to conduct a needs assessment of people living with HIV. The assessment revealed that many people living with HIV were desperately in need of food items to remain adherent to their medication. Enrique jumped into action, and within a few days, he worked tirelessly with the Ministry of Health, Development, Social Transformation, and Poverty Alleviation to expedite assistance to those individuals through the Government of Belize's Food Assistance Program. Loss of employment, lack of essential living support, and depleting nutritional supplies are some of the main issues that undermine adherence to HIV medication. COVID-19 has indeed exacerbated these circumstances. In Jamaica, Candace Livermore, Executive Director of the Jamaica AIDS Support for Life, JASL, responded to the needs of our clients by soliciting donations and writing proposals for small grants to support clients with nutritional support, care packages, sanitation items, and financial support for transportation to attend clinic visits. Such actions, in the face of so many adversities, may have saved many lives and protected the gains made in the region's HIV response. In Barbados, Dr. Natasha Rambaran and her team from Equals Barbados arranged for delivery of multi-month medication supplies, provided care via telemedicine, and donated food hampers sourced from donations of an external grant. These are just a few examples of our Caribbean public health champions recognizing their shared responsibility and taking decisive action to ensure the continuity of HIV services during COVID-19. COVID-19 has thrown our national programs and civil society into circumstances that demanded their best. I am humbled and inspired by the response of our public health practitioners and civil society leaders. I have only highlighted a few of these practices that have emerged from the region, but there are so many more success stories to share. This World AIDS Day, I urge our partners to share their stories and celebrate the success of maintaining the region's HIV response in the face of COVID-19. Our region has responded to the global pandemic with cooperation, unity, and innovation, which ensured the continuity of HIV services and better health outcomes for people living with HIV. Our governments, national programs, community mobilizers, and the public sector stepped up to provide the needed services so that people living with HIV can remain on their medication. Time will reveal how many lives were saved because our region acted promptly and effectively. I do believe that despite the challenges of 2020, our region can amplify the HIV response and fulfill the CRF's mandate of a Caribbean free of AIDS and new HIV infections, in which all people are happier, healthier, productive, safe, and respected. The partnership remains committed to supporting this momentum, and we stand in solidarity with everyone as each of us do our part in ending AIDS in the region.